Why did you choose to specialize in maternity nursing?
I chose to specialize in maternity nursing because I have always been passionate about women's health and the transformative journey of childbirth. During my training, I was deeply moved by the unique bond that develops between nurses, mothers, and families during such a pivotal moment in their lives. The opportunity to provide compassionate care and support, particularly during the vulnerable stages of pregnancy, labor, and postpartum, felt like a calling to me. Maternity nursing combines technical expertise with a human-centered approach, which resonates strongly with my values as a healthcare professional. I enjoy the challenge of adapting to the unpredictable nature of this field, whether it involves managing complications during labor or simply being a comforting presence for a new mother. Additionally, I find great fulfillment in educating families, empowering them with the knowledge and confidence to care for their newborns. This specialty also offers the opportunity to advocate for women's health on a broader scale, addressing cultural and societal challenges that may affect maternal care. Knowing that my work directly contributes to the health and well-being of both mothers and babies gives me a profound sense of purpose, which is why I dedicated myself to maternity nursing.
Describe your experience with different stages of labor and delivery.
Throughout my career, I have gained extensive experience managing and supporting patients through the different stages of labor and delivery, ensuring safe and positive outcomes for both mothers and babies. In the early labor stage, I focus on assessing the mother's condition, monitoring vital signs, and offering emotional reassurance. I also educate patients and families about what to expect as labor progresses, addressing their questions and alleviating any concerns. During the active stage of labor, I am proficient in monitoring fetal heart rates, uterine contractions, and maternal well-being using advanced equipment while maintaining close communication with the healthcare team. I ensure timely interventions when necessary, such as administering pain relief or preparing for potential complications. My ability to remain calm and composed under pressure has been essential in these moments, particularly when assisting with high-risk pregnancies or unexpected challenges. In the transitional stage and delivery, I work closely with obstetricians and midwives, assisting with positioning, guiding effective pushing, and supporting the mother through the most physically and emotionally intense moments. I am skilled in ensuring a sterile environment and preparing for immediate neonatal care, such as resuscitation, if required. Finally, during the postpartum stage, I focus on monitoring the mother for signs of hemorrhage, infection, or other complications while providing comprehensive care for the newborn. I take pride in educating and supporting families as they adjust to their new roles, promoting breastfeeding and ensuring that both the mother and baby leave the hospital in good health and with confidence in their care plans. This hands-on experience across all stages of labor and delivery has honed my ability to provide safe, empathetic, and effective care, ensuring that every family I work with feels supported and empowered throughout their birthing journey.
What is your approach to supporting a woman experiencing difficult labor?
My approach to supporting a woman experiencing difficult labor is centered on providing comprehensive, compassionate, and evidence-based care while fostering a sense of trust and empowerment. Labor can be both physically and emotionally challenging, so my priority is to remain calm, patient, and reassuring throughout the process. The first step is a thorough assessment to understand the specific challenges the mother is facing, whether they are related to prolonged labor, pain management, fetal distress, or emotional stress. I collaborate closely with the healthcare team to implement the appropriate interventions, ensuring timely and coordinated care. This could involve adjusting positions to optimize fetal descent, administering medications, or preparing for potential medical procedures such as instrumental delivery or cesarean section. Pain management is a critical aspect of difficult labor, and I tailor my approach to the patient's preferences and medical needs. I offer a range of options, from breathing and relaxation techniques to pharmacological interventions, ensuring that the mother feels supported and in control of her choices. Equally important is emotional support. I continuously communicate with the mother, explaining what is happening, addressing her concerns, and providing encouragement. I also involve her partner or support person, guiding them on how they can assist and contribute positively to the experience. Throughout the process, I monitor both the mother and baby closely, ensuring that any signs of complications are addressed promptly. My goal is to balance medical care with empathy, helping the mother feel safe and cared for even during a challenging labor. Ultimately, my approach is guided by the understanding that difficult labor is not only a clinical situation but also a deeply personal experience. By providing holistic support, I aim to create a positive and empowering environment where the mother can feel confident and cared for, no matter the circumstances.
How do you assess fetal well-being during labor?
Assessing fetal well-being during labor is a critical aspect of ensuring a safe outcome for both the baby and the mother. My approach involves a combination of continuous monitoring, clinical observations, and effective communication with the healthcare team and the mother. One of the primary tools I use is fetal heart rate, FHR, monitoring, which can be done either intermittently with a Doppler device or continuously using an electronic fetal monitor, depending on the risk level of the pregnancy. I assess the baseline fetal heart rate, variability, and the presence of accelerations or decelerations. These patterns provide valuable insights into the baby's oxygenation and stress levels. For example, late decelerations or decreased variability may indicate fetal distress, prompting immediate interventions. I also evaluate uterine contractions using either palpation or tokodynamometry to understand their frequency, duration, and intensity. This helps determine how well the fetus is tolerating labor. Additionally, I assess the mother's condition, including her hydration status, oxygenation, and any signs of infection, as these factors can directly affect fetal well-being. If necessary, I perform further assessments, such as checking for the presence of meconium-stained amniotic fluid during rupture of membranes, which may indicate fetal distress. In high-risk cases or when FHR patterns are concerning, I collaborate with the team to consider more advanced diagnostic tools like fetal scalp sampling or internal monitoring. Throughout this process, I prioritize clear communication with the mother, explaining the steps being taken and any findings. This ensures she feels informed and supported during labor. By combining clinical expertise, continuous vigilance, and compassionate care, I ensure that fetal well-being is thoroughly assessed and that any concerns are addressed promptly to promote a safe and positive labor and delivery experience.
Describe your experience with managing postpartum hemorrhage.
Managing postpartum hemorrhage, PPH, has been a vital aspect of my clinical experience, requiring both technical expertise and prompt, decisive action to ensure the safety of the mother. PPH is a potentially life-threatening condition, so I am well-versed in recognizing early signs, initiating interventions, and collaborating effectively with the healthcare team to manage it. When faced with PPH, my first priority is to perform a rapid assessment to identify the underlying cause, whether it is uterine atony, retained placental tissue, trauma, or coagulopathy. I immediately assess the mother's vital signs and estimate blood loss accurately to determine the severity of the hemorrhage. Using the 4Ts approach, tone, tissue, trauma, and thrombin, I systematically evaluate potential causes and guide the treatment plan accordingly. For uterine atony, which is the most common cause, I initiate uterine massage and administer uterotonic medications such as oxytocin, misoprostol, or carboprost to stimulate uterine contractions. I ensure the intravenous access is patent for fluid resuscitation, administer crystalloids or blood products as needed, and monitor for signs of hypovolemic shock. In cases involving retained tissue, I assist in preparing for manual removal or surgical intervention, such as dilation and curettage. If trauma is suspected, such as vaginal or cervical lacerations, I assist with identifying and repairing the injury. For rarer causes like coagulopathy, I ensure that laboratory tests are expedited and collaborate with the team to administer appropriate blood products or clotting factors. Throughout this process, I maintain clear communication with the patient, providing reassurance and keeping her informed about each step of care. I also ensure that her emotional needs are addressed during this potentially frightening experience. My experience managing PPH has reinforced the importance of vigilance, teamwork, and a systematic approach in critical situations. It has also deepened my understanding of the importance of postpartum monitoring and education to reduce risks and promote recovery.
What are some key teaching points you would provide to a new mother before discharge?
Before discharging a new mother, I prioritize providing comprehensive education to ensure she feels confident and prepared for her postpartum recovery and newborn care. My teaching points focus on key areas that promote health, safety, and emotional well-being. For postpartum care, I emphasize the importance of monitoring for signs of complications such as excessive bleeding, persistent pain, fever, or signs of infection. I explain what is considered normal, such as mild cramping or light bleeding, and what would warrant immediate medical attention. Proper perineal care, managing stitches or cesarean incisions, and recognizing the signs of deep vein thrombosis are also essential topics. I discuss the physical and emotional changes that can occur postpartum, including baby blues and postpartum depression. I reassure the mother that emotional shifts are common and encourage her to seek help if she experiences overwhelming feelings of sadness, anxiety, or hopelessness. I also highlight the importance of adequate rest, hydration, and nutrition to support her recovery. For newborn care, I provide clear guidance on feeding, whether breastfeeding or formula feeding. For breastfeeding mothers, I offer tips on proper latching, feeding frequency, and recognizing signs of effective feeding. For formula feeding, I explain proper preparation, storage, and feeding schedules. I also discuss the importance of monitoring wet and dirty diapers as indicators of the baby's hydration and nutritional status. Safe sleep practices are another critical teaching point. I stress the importance of placing the baby on their back to sleep, using a firm mattress, and avoiding loose bedding or toys in the crib. I also cover the importance of skin-to-skin contact, safe bathing practices, and the correct way to hold and handle the baby. Finally, I provide resources for follow-up care, such as scheduling the mother's postpartum checkup and the baby's pediatric appointments. I ensure she knows how to reach out if she has any questions or concerns after discharge. By focusing on these key teaching points, I aim to empower new mothers with the knowledge and confidence they need to navigate this transformative stage of life safely and positively.
Describe a time you had to advocate for a patient's wishes during labor or delivery.
During my practice, there was a memorable instance where I had to advocate for a patient's wishes during labor. The patient, a first-time mother, had created a detailed birth plan expressing her desire for a natural, unmedicated birth. As labor progressed, it became challenging, and there was a suggestion from another team member to expedite delivery with interventions, including an epidural and potentially a cesarean section. While the situation was not an emergency, the patient felt overwhelmed and conflicted. I took the time to sit with her, review her birth plan, and discuss her concerns and preferences. I ensured that she had a clear understanding of her current progress and the medical team's recommendations. I also relayed her wishes to the team, emphasizing her desire to attempt natural methods for as long as it was safe to do so. To support her decision, I worked closely with the team to implement non-pharmacological pain management techniques, such as breathing exercises, position changes, and the use of a birthing ball. I continuously monitored both her and the baby's well-being to ensure that her choices were not compromising safety. Ultimately, the mother successfully delivered vaginally without the need for an epidural, as she had hoped. She expressed gratitude afterward, saying that being heard and supported made a significant difference in her experience. This experience reinforced for me the importance of patient-centered care and advocacy in labor and delivery. By balancing the mother's wishes with medical safety, I was able to help her feel empowered and respected during one of the most important moments of her life.
How do you handle a situation where a patient's birth plan conflicts with medical recommendations?
When a patient's birth plan conflicts with medical recommendations, I approach the situation with empathy, clear communication, and a commitment to patient-centered care. My primary goal is to honor the patient's wishes as much as possible while ensuring the safety of both the mother and baby. The first step is to engage in a calm and respectful conversation with the patient, acknowledging the importance of her birth plan and validating her feelings. I carefully explain the medical situation, the recommendations being made, and the potential risks and benefits associated with both following and deviating from her plan. I make sure to use clear, non-technical language to ensure she fully understands the rationale behind the medical advice. I also provide options whenever possible, outlining alternative approaches that may align more closely with her preferences while maintaining safety. For instance, if a patient wishes to avoid an epidural but the team recommends intervention due to prolonged labor, I might explore other pain management techniques or discuss minimally invasive alternatives to address the situation. In cases where a compromise isn't feasible due to urgent medical concerns, I strive to build trust by reinforcing that the recommendation is made with her and her baby's well-being as the top priority. I involve her in the decision-making process, ensuring she feels empowered and informed rather than pressured. Throughout the process, I act as an advocate for the patient, communicating her concerns and preferences to the healthcare team. I also offer emotional support, recognizing that altering a birth plan can be a deeply emotional experience. By maintaining a compassionate and collaborative approach, I aim to help the patient feel respected, supported, and confident in the care being provided, even if her original birth plan needs to be adjusted for safety reasons.
What are your strengths as a maternity nurse?
As a maternity nurse, my strengths lie in a combination of clinical expertise, strong communication skills, and a compassionate approach to care. These qualities enable me to provide safe, effective, and patient-centered care during one of the most significant moments in a family's life. One of my key strengths is my ability to remain calm and focused in high-pressure situations, such as managing complications during labor or responding to emergencies like postpartum hemorrhage. My training and experience have equipped me with the knowledge to recognize early warning signs and implement appropriate interventions promptly, ensuring the safety of both mother and baby. I am also skilled in fostering strong, trusting relationships with patients and their families. I understand that labor and delivery can be both exciting and overwhelming, so I prioritize clear and empathetic communication. Whether educating first-time parents about the birthing process, addressing their concerns, or guiding them through unexpected challenges, I strive to create an environment where they feel supported and empowered. Another strength is my adaptability and collaborative nature. Maternity care often requires working with multidisciplinary teams, and I excel at coordinating efforts to achieve the best outcomes. Whether assisting during cesarean delivery, supporting natural childbirth, or providing postpartum education, I adjust seamlessly to meet the needs of each situation. Finally, I am deeply committed to continuous learning and staying updated on best practices in maternity care. This ensures that my skills and knowledge are aligned with the latest evidence-based guidelines, enabling me to provide the highest standard of care. Overall, my strengths as a maternity nurse stem from my dedication to holistic, patient-centered care, my ability to perform under pressure, and my passion for making a positive impact during the transformative journey of childbirth.
How do you stay up to date with the latest evidence-based practices in maternity care?
Staying current with evidence-based practices in maternity care is a priority for me. I actively engage in several strategies to ensure my knowledge and skills remain up to date. I regularly review professional journals such as the Journal of Obstetric, Gynecologic, and neonatal nursing in the British Journal of Midwifery, paying close attention to research articles, clinical guidelines, and best practice recommendations. I also participate in continuing education opportunities, including online courses, webinars, and conferences offered by reputable organizations like the Royal College of Midwives or the Association of Women's Health, Obstetric and Neonatal Nurses. These opportunities often provide updates on the latest research and advancements in areas such as fetal monitoring, pain management during labor, and postpartum care. Furthermore, I value collaborative learning and regularly discuss complex cases and emerging best practices with colleagues, including midwives, obstetricians, and other members of the multidisciplinary team. Engaging in these discussions allows me to gain different perspectives and stay informed about current trends in the field. I also find that engaging with professional organizations and their resources, like accessing their online libraries and attending local chapter meetings, is very beneficial. By combining these approaches, I ensure I'm providing the highest quality, evidence-based care to my patients and their families.